How often is mental illness actually a crisis of meaning or spiritual disconnection? And if it is, and suffering is rooted in lost meaning, can medication ever be the answer?
No, never. It's actually an impediment. And so what's interesting is we have this umbrella term called mental illness. And so then people think about that, they associate it with maybe someone who's homeless on the street and has schizophrenia. And that's actually a quite rare condition, which we treat very poorly here in the United States with antipsychotic drugs, which just create metabolic illness and a cascade of other problems, where other countries who approach the condition differently have much better response rates. But what is under the umbrella now of mental illness? I guess mental illness is anything that causes some emotional distress at all, any suffering. And what I see in my practice 15 years ago, you'd have a percentage of people that came in on like one psychiatric drug. Now it's rare for us to see anybody come into our center without it being on at least one psychiatric drug. On all of these conditions, nearly 100% of these conditions started with a very understandable life circumstances. And their response to the life circumstances can be problematic. It can either lead you to overcome it, or you can then go down a road in which you self-identify as being ill or broken, and it alters your own perception of who you are. But when we talk about these conditions that are on the rise, depression and anxiety, for example, those labels, I really do believe it's a crisis of meaning. We're more excluded from each other. We're separated. We're in this illusion of separation. And the more you get disconnected and then you throw yourself into technology and you're living this virtual world under artificial lighting.
I can't wait to ask you more about this.
Yeah,
we'll save that for later.
I mean, you're basically eating poisons, right? You have this, you're detached from natural light. You're not connected to nature in the way that we used to be. You're not interacting together. You're creating this virtual world. And one of the things that I've done in every single evaluation is ask somebody, because they're often looking for some type of label or diagnosis for what they're feeling. I'll say, pull out your phone. Let's look at your screen time. And I've seen this over the past 15 years. It would start off with someone's like on their phone for like 2 hours a day. And I used to think that was, way too much. And now I'm seeing 8 to 10 hours on that phone is typical for a younger generation. So younger generation, I'll say somewhere between 16 and 25, that core group that's turning to these drugs. They're self-labeling with these conditions. I have depression. I have ADHD.
Yes, they are.
And they're looking for the chemical solution.